I'm Vanessa Albritton with the Health Account Management Division here at CalPERS. Now, before we get started, I have a couple of housekeeping items. First, this webinar will be recorded and posted online in about a week or so that anybody who missed it can view it later. At the end of the presentation, members of the health team and I will answer as many questions as time allows. You can submit your questions to OE_member_webinar@calpers.ca.gov. This email address is also in the description of this live stream, along with a link to the slide deck and the post-webinar survey, which we'll email to you later today. And for closed captioning, you can go ahead and click on the CC button below. Okay, so today we'll talk about what open enrollment is, walk through health plan changes for 2025, share key open enrollment resources, and provide an overview of targeted communication before jumping into the Q&A. So what is open enrollment? So open enrollment is a yearly event held in the fall for those eligible for health benefits. This is the one time of year you can make changes to your health enrollment without a qualifying life event. Qualifying life events are things like moving, getting married, having or adopting a child. So this year, open enrollment is September 16th through October 11th, and changes take effect on January 1, 2025. So during open enrollment, you can newly enroll in a CalPERS health plan. Or if you're already enrolled, you can change your plan. You can also add or remove dependents or cancel your coverage altogether, but we actually don't see this very often. Open enrollment for State of California and California State University-sponsored dental and vision plans is also September 16th through October 11th. You can find contact information on the dental and vision benefits page on the CalPERS website. State and CSU active members, for questions or to make changes to your enrollment, you'll contact your HR department. State and CSU retirees, you'll contact us for dental and VSP directly for vision. If you're a public agency or school member, whether active or retired, you'll contact your HR department or the HR department of the agency you retired from. All right, let's jump into the 2025 health plan changes. You can find a summary of all the health plan changes we'll cover today on the annual health plan changes webpage. Please note, there are no other changes to our health plans or benefits except for those shared here. So first up, we have some expansions, giving members more choices in certain areas. Some expansions cover the full county, and others only cover specific zip codes within a county. Links to the specific zip codes can be found on the annual health plan changes page I just mentioned. So Blue Shield Trio will expand into Contra Costa County and 3 zip codes within Shasta County, mostly around Redding. HealthNet Saluti Moss will expand into Imperial County. Kaiser Permanente will expand into 14 zip codes in northern Monterey County. And United Healthcare Signature Value Harmony will expand into Napa County. 50 out of the 52 zip codes in Contra Costa County and 2 zip codes in Solano County. So next we have some health plan exits. When this happens, we automatically enroll members into a comparable plan effective the first of the following year if they don't make a change during open enrollment. We call these administrative transfers. So first up, Anthem Blue Cross Del Norte EPO will no longer be offered as a result of the PPO administrator change, which I'll cover shortly. These members will be enrolled in Blue Shield EPO. Western Health Advantage will no longer offer a Medicare Advantage plan. This is for their entire book of business, not just CalPERS. Members in Napa County will be enrolled in United Healthcare Medicare Advantage. Members not living in Napa County will move to Blue Shield Medicare. Lastly, we'll no longer offer United Healthcare Medicare Advantage Edge. This plan had a proposed 50% premium increase, which would have made it the most expensive Medicare plan offered. These members will move to the United Healthcare Group Medicare Advantage plan. And again, if you're enrolled in one of these plans, we'll only administratively transfer you if you do not choose another plan during open enrollment. So If you're good with the admin transfer plan shown here, there's no action for you to take, but you should still explore options. Okay, so the biggest change this year is that Blue Shield of California will be the new administrator for PERS Gold and PERS Platinum Basic and Medicare PPO plans. And for an even better PPO healthcare experience, CalPERS is partnering with Blue Shield and Included Health to ensure members in a basic PPO plan receive the highest quality care for their unique needs. Medicare members, you will not see any changes to the provider networks or care coordination that is currently provided by your doctors. And you'll work directly with Blue Shield for healthcare services. Now for basic PPO members, so members not enrolled in Medicare, Included Health is your first stop for comprehensive and personalized healthcare. They're available by phone, online, or mobile app for help navigating healthcare and CalPERS health benefits. Whether you need a new primary care doctor, have questions about a medical bill, or want an easy way to keep track of your insurance information, Included Health is there. So we understand this transition is a big change, which is why we felt it was important to have Included Health available to assist you prior to January 1, 2025. So we encourage you to reach out to them with any questions and to confirm your in-network providers. Now to clarify what's not changing with the new PPO administrator. The names of our plans, PERS Gold and PERS Platinum, they'll stay the same, and so will their service areas. PERS Gold is available everywhere in California, and PERS Platinum is available across the country and around the world. The underlying health benefit structure is also not changing. This means that the copays, coinsurance, and deductibles our members in Basic and Medicare have today will all stay the same in 2025. And pharmacy benefits will continue to be administered through OptumRx, our pharmacy benefits manager. And in case you missed it, there was a webinar held on August 22nd that took a deep dive into this new partnership. To learn more about the PPO administrators, you can view a recording of this webinar on our YouTube channel. The direct link is here in this deck as well. Also available is a web page that summarizes the PPO changes, along with a list of frequently asked questions that came out of the webinar. We hope these resources are helpful to you, but again, do not hesitate to contact Included Health for any questions about the basic PPO plans. And as a reminder, if you're a Medicare member enrolled in one of our PERS Gold or PERS Platinum Medicare supplement plans, you will contact Blue Shield directly with any questions, not Included Health. Lastly, there are two new benefits for 2025. For basic members only, there is a doula benefit available for those who are pregnant or postpartum. And then for both basic and Medicare, there is a new benefit to cover up to $5,000 for travel and lodging for certain medically necessary services if you can't access this care within 50 miles of your home. So now we'll cover some valuable open enrollment resources. Okay, so one of the most comprehensive resources is our dedicated open enrollment webpage. We have one tailored for active members as shown on this slide, and one tailored for retirees. If you're a retiree and found yourself on the active members page, there's a link that will take you directly to the retiree page. There's a similar link for active members on the retirees page. But both pages provide guidance on what to do while preparing for open enrollment, how to make open enrollment changes, and what to expect after open enrollment. Here you'll also find links to all the resources and information I'm covering today. So just before open enrollment begins, we recommend you access your guide to choosing a health plan. It serves as a checklist to help guide you through things to consider when choosing a new health plan. The checklist emphasizes considerations like cost, coverage, and availability. And it also lists resources to help you find detailed information in these areas. You'll find a link to the guide on the open enrollment web pages. It also appears in the 2025 Health Benefits Summary, which I'll cover in a moment. Another great resource is the Plans and Rates webpage. Like the open enrollment pages, there are two versions, one for active members and one for retirees. The one shown here is for retirees. Here you'll find a link to my CalPERS, the Health Plan Search by Zip Code tool, and the open enrollment pages I just mentioned. As you scroll through the Plans and Rates page, you'll find a full listing of health plans and premiums. They're separated by year and employment category. State and CSU members, you'll see health plan premiums and your employer contribution amounts here. Public agency and school members, you'll see health plans and premiums by region. But since your employer contribution amounts vary by employer, you'll want to check with them to confirm how much they contribute towards your health benefits. On this page, you'll also find a link to the health plan's summary of coverage and evidence of coverage documents, which I'll talk more about in a moment. Okay, so on to publications. The Health Benefits Summary provides a general overview of health benefits and compares covered services, co-payments, and benefits for each health plan. Here you'll find a copy of the Guide to Choosing a Health Plan, which I mentioned. This is a new feature, so be sure to check it out this year. The Medicare Enrollment Guide provides information about how Medicare works with your CalPERS health benefits. And the Health Program Guide describes CalPERS eligibility rules and enrollment processes, including how life changes or changes in your employment status can affect your benefits and eligibility. All of these are available on the CalPERS website under Forms and Publications. So each of our health plans provide an evidence of coverage booklet, which describes in detail the available benefits and limitations for each plan. If you ever have questions about covered services, specific benefits that are available, you'll want to check here. You'll find links to the evidence of coverage booklets in the Forms and Publications section of our website. And as I mentioned earlier, you'll find a link to this section on the Plans and Rates page as well. If you'd like a paper copy sent to you, you can request it directly from the health plan. All 2025 evidence of coverage documents should be available by September 16th, the first day of open enrollment. Now, the most valuable open enrollment resource of all is your MyCalPERS account. Here you'll find customized open enrollment information and your health plan statement, which I'll talk more about in a minute. You'll also see special messages just for you, like if your premium is increasing by more than 9% or there are new health plan options in your area. We'll tell you that here. MyCalPERS is also where you can access the Search Health Plans tool. This tool allows you to search for health plans available in your area. You can also include your doctor or a medical group in your search if you want to see which plans they're available through. You may be able to switch to a lower cost plan and still keep your doctors and specialists. The search results display monthly premiums and member satisfaction ratings for each plan. And you have the option to compare to see side-by-side differences in premiums, copays, and benefits. Most members can make health enrollment changes online. However, active members, you must check with your employer before making changes online, as they may want you to follow a different process. So prior to open enrollment, we send a lot of targeted communication to you, our members. We want to ensure that you're aware of important dates, all of the changes I just covered, and helpful resources as we approach open enrollment. We really want you to be well informed so that you can find the health plan that's right for you. So the week prior to open enrollment, your customized health plan statement will be available online in your MyCalPERS account, as well as a link to the open enrollment newsletter. For those who have chosen to receive these items by mail, they're mailed at this time as well. So this year, it was this past Monday, you should have received an email letting you know your health plan statement is available. It provides custom information, a summary of your enrollment, and what your current and future premium will be if you don't make a plan change. And even if you have elected to receive it by mail, it's always available in your MyCalPERS account. The open enrollment newsletter provides health program highlights, changes to health benefits, and other important information to assist you in preparing for open enrollment. Even if you don't plan on making changes, you'll want to review your health plan's premium for next year. Premiums change every year, so you don't want to be surprised by an unexpected change in cost. Okay, so as I mentioned, we send a lot of communication your way this year. In mid-July, we sent emails announcing the new PPO administrator. And in late July, we sent emails announcing all health plan changes for 2025. As I mentioned, this week we sent emails announcing the health plan statement is available. And then we'll send a few more emails in September and into October to remind you that open enrollment is beginning and when it's ending. In addition to those emails, we mail you customized letters about changes that may significantly impact you. These letters encourage you to shop and compare health plans in your area, and we inform you that you may be able to switch to a lower cost plan and still keep your doctors or specialists. In July, we mailed letters to those of you enrolled in a PPO to announce the new PPO administrator. And in late August, we mailed letters to members impacted by a 9% or higher premium increase, health plan exits, and a reminder about the PPO administrator. In addition to all the emails and letters we send, we share open enrollment communication through perspective blogs, social media posts, and our CalPERS website. So as I mentioned earlier, you can make changes through your CalPERS account. You can also submit your open enrollment requests by mail or fax. Retirees would send these to us, CalPERS, and active members, you would send them to your employer. Retirees, you can also call us at 888-CalPERS. Most requests can be completed over the phone, or you can make an appointment with one of our regional office team members. You can schedule an in-person visit or a phone or video appointment through your CalPERS account. And just a reminder for active members, so those of you still working, be sure to check with your employer before making changes online through your CalPERS account. They may want you to follow a different process. So that concludes our webinar. And now the health team and I will jump into some questions. Again, we'll answer as many questions as time allows. And in about a week, we'll post the recording of this webinar along with FAQs from today to our website. And of course, we'll send you an email once that information has been posted. So just give me a moment while I check out the chat. Okay, so as a reminder, if you are happy with the plan that you're in, there's no need to make changes during open enrollment. There's no action for you to do. You're okay to go. You'll have your plan next year, so you can be assured of that. And you can find the 2025 rates and health plans on the Plans and Rates webpage. So that was one of the resources that I covered today. A full listing is there. You can also find that in your CalPERS account. So will PPO administration change from PERS to Blue Shield affect United Healthcare Advantage PPO? So with the administration change, we're moving from all the PERS Platinum and PERS Gold plans will be administered by Blue Shield. And that is only applies to the PERS PPO plans, not United Healthcare Advantage Medicare PPO. That is a question that we are getting a lot, and United Healthcare is not affected by this at all. So a question for Lisa. So we have member transitioning to Medicare in December. Can you explain how this works so I can keep my Anthem PPO?
Sure. Happy to answer this one. Anthem will no longer be our TPA for our PPO plans for both basic and Medicare starting in January of 2025. Instead, we have contracted with Blue Shield, and they will administer both our Medicare and basic PPO plans. However, for Medicare, this should not impact your provider choice or your provider networks at all.
Great, thank you, Lisa. So, question for Yesenia. Can you give us more information about Included Health and how to reach them?
Sure. So through the change to Blue Shield for the PPO administrator, we've also partnered with Included Health to provide member services. And so they will be assisting with care coordination, any assistance that typically they would help as far as provider navigation, if you want to know if your provider's in network, if you want assistance with your billing, anything like that. They're also providing virtual health through primary care and behavioral health. They're bringing that services in. So member services will be going through Included Health for our Platinum and Gold basic members.
Thank you. So another question, I am currently enrolled in United Healthcare Medicare Advantage Edge. However, this plan is not being offered in 2025, which I mentioned. Can I do nothing and be automatically enrolled into United Healthcare Medicare Advantage PPO, or do I have to specifically request this plan? So as I mentioned, those will be automatic. There's no action for you to take if you want to automatically enroll into the Medicare Advantage PPO with United Healthcare. Where can I find a simple comparison of Medicare plans? So our 2025 Health Benefits Summary provides a side-by-side comparison of key benefits in all of our plans. You can view and download the Health Benefits Summary from our website. So Lisa, can I still call the doctor for a visit, or do I need to call IH first? I don't understand IH's role in everything.
Sure, good question. No, if your doctor will remain in network with Blue Shield in January of 2025, which we expect the majority of providers to be in network with Blue Shield, then you can continue to contact your doctor in the way you have done it previously. Included Health exists, as Yesenia was describing, to be sort of your one-stop shop for member questions or concerns, or if you need help with essentially anything related to your healthcare. That might be a claims question or a billing question. If you want to find a new provider or a different type of provider, if you're having trouble scheduling an appointment or a service, Included Health exists to help with all of that. If you aren't sure if your provider will be in network, you can also call Included Health and they can help with that determination. If it appears that your provider will not be in network, Included Health can also assist you with applying for continuity of care if you are eligible, and then you might be able to continue seeing that provider even though they aren't in network for a period of time until you're able to find a new provider. So they really are there to support and assist you in every way possible with your healthcare. But if you don't need them, you don't have to use them if you have your provider and you're comfortable reaching out to them on your own, and et cetera.
Thank you. So another question, in general, how do I check if my doctor will be in network for a specific plan for 2025? So you can use the Search Health Plans tool in my CalPERS and include your doctor in your search. You can also contact that plan, a plan that you're considering enrolling with, to confirm if they are available through that plan. You can contact the provider as well. During the open enrollment period, if you made a mistake in choosing a health plan, can you modify it within the open enrollment period? So I believe the answer is yes. Melissa, can you share more about that process?
Yeah, of course. So if you have a correction to make during the open enrollment period, you can submit a new request either to CalPERS if you're retired or to your employer if you're active, and we'll take the most recent request. But that has to be completed then by the end of open enrollment. Once open enrollment's over, you can't make a correction unless you want to just go back to the plan you had prior to your change. And that can take place before January. As long as we get that request before January, we can go ahead and undo your open enrollment request.
Thank you. So another question, the Anthem PERS Gold had a blue card program that was able to be used when traveling out of state. Will that program still be available with Blue Shield? And the answer is yes. For PORAC Anthem Blue Cross, is this changing to Blue Shield? No, I don't believe this change affects PORAC. Yesenia, would you like to confirm that?
That is correct. There is no changes to the PORAC administrator.
Thank you. Will we continue to use Optum Rx for the PERS Gold and PERS Platinum pharmacy benefits? And that is, yes, you will continue to use Optum Rx. Question for Melissa. Member will be 65 in 2025 and sign up for Medicare. Their dependent will be reaching 26 years old in 2025. They have a Kaiser HMO basic and plan to stay with Kaiser for 2025. Any concerns? Sorry, I just lost the question. It moved. Any concerns I should have during the open enrollment period?
No, I mean, you can still, of course, change your plan during open enrollment as anyone can. But for your upcoming Medicare coordination, we will be, of course, sending you lots of notifications about that transition over to Medicare. If you choose to stay in Kaiser, we will automatically enroll you into the Kaiser Permanente Senior Advantage plan, unless you would like to change plans, and you can do that either during open enrollment or when you are eligible for Medicare. And as far as your 26-year-old, again, we will send you lots of notifications of that transition and offer COBRA coverage for your 26-year-old dependent as they age out of the plan. So just keep an eye in your mailbox and in your MyCalPERS account for those notifications.
Thank you. And will I receive a new health card now that Blue Shield is the new PPO administrator? Yes, you will receive a new health plan ID card in the mail. I want to say December timeframe. But if you don't receive it by January 1, you should definitely contact Included Health or Blue Shield, depending on if you're a basic or Medicare member. So as a reminder, members enrolled in the basic PPO plans, you'll contact Included Health. And Medicare members, you'll go directly to Blue Shield. So another question on Medicare. I'm trying to switch Medicare plans. Where can we find out the coverage information and rate changes, if any? Melissa?
Sure. So again, if you want to log into your MyCalPERS account, you can see all the plans that are available in your area using your zip code. And also premium information is available there. It's also available on our plans and rates page on the website. And in the 2025 health benefits summary, you can see available plans and coverages in a side-by-side comparison. That's very useful.
Thank you. For retirees on Medicare, if you move to another state, will Blue Shield cover services and doctors in another state? Yesenia or Lisa, do you want to add clarification on out-of-state coverage with the PPO plans?
I believe the answer to that question is yes. Yesenia, feel free to add anything else, but I think it's a yes.
Thank you. Is Included Health an independent contractor, or are they part of Blue Shield?
I can answer that one.
Thank you.
CalPERS has independently contracted with Included Health separately from our contract with Blue Shield.
Great, thank you. And health team, if I've missed a specific question, please feel free to clarify or jump in at any time.
There was one question, Vanessa, about the explanation of benefit documents and when they will become available. So for the basic members, those will be displayed on the Included Health microsite later by the end of next week. And for the supplemental plans for Gold, those will be available on Blue Shield's site later next week.
Thank you so much.
Vanessa, I think there was a question about how someone with a rare chronic condition might be able to get help from Included Health in maintaining their relationship with their current provider. So I just want to clarify that for members with a complex or a serious chronic condition that are under current treatment with a provider or providers, you may well be eligible for continuity of care, where you were able to maintain your relationship with that provider or providers for up to 12 months until there's a time when you can transition to new, equally appropriate providers. Included Health, part of their job is to help assist you with that process, and they can help you apply for continuity of care with Blue Shield.
Great, thank you so much. How do I find the health statement for 2025? I haven't seen mine yet. So your health plan statement is in your CalPERS account. So log into your CalPERS account. You can go to statements, and then you'll find your health plan statement there.
And Vanessa, there was a question about pharmacy coverage through Optum and if that's going to continue next year. And I'm assuming that's for the PPO plans. So yes, your current pharmacy benefit manager, Optum RX, will continue to provide those services through 2025.
Yes, thank you. And another question, is there an out-of-pocket expense for the EPO plan? And EPO co-payments are the same as HMO co-payment amounts. That clarifies. So Melissa, is it okay to sign up for health insurance for the whole family through their employer? And can they sign up for dental and vision through their employer?
So I think this maybe is a married couple that has coverage through both employers, as I think maybe the question. So it's really up to your employer to determine, how that works. But yeah, generally, if it's through the state of California, you can have one employee cover themselves and all dependents for health, and another employee can cover that's those same family members for dental and vision separately. So, but again, you'd really want to talk to your HR department about that, since CalPERS does not manage the dental and vision programs.
Thank you. So another clarifying question for continuity of care, Lisa. We have a situation where a dependent has ongoing medical issues and an upcoming surgery related to another surgery done with Anthem PPO. Will Blue Shield cover the medical needs related to that surgery performed before Blue Shield?
Yes, so this should fall under continuity of care provisions, we are requiring Blue Shield, the new administrator, to follow the continuity of care provisions that are outlined actually under state regulations. And those provisions, they allow for up to 12 months of continuity of care for eligible members that meet certain conditions, one of which is if you have an already scheduled surgery or other procedure that has been approved and will occur within 6 months. So I would encourage you to reach out to Included Health and to have them assist you with applying for that continuity of care with Blue Shield.
Thank you, Lisa. Okay. Not seeing any new questions.
There's one, another one for Lisa on doula services, if you can expand on that for 2025, and if it's for a specific plan only.
Yes, sure. No, it's not limited to any particular plans. We've added a doula benefit for all of our basic members and both the PPO and all of the HMOs. The doula benefit covers prenatal and postpartum services as well as labor and delivery services, and it applies to abortions, miscarriages, and stillbirths as well. So I would encourage you to go to the EOC when it's available very soon, and there are more details there. But again, it is available for all basic members.
Great. And to clarify, our HMO plans are not being discontinued. That was a question that came up. So we don't have any HMO plans that are being discontinued. And question about primary care. As I confirm, my primary care doctor will take one of the PPOs. Am I telling him or her that the plan is with Blue Shield or included? And so my understanding it's Blue Shield. You would that's on your card, and you would show your medical card. Do you want to add any clarification to that, Lisa?
I would just say that's correct. Blue Shield is the administrator, so they are in charge of the provider contracts and the provider network. So you would tell your primary care doctor that your health insurance coverage is with Blue Shield.
And question about where to find the state's monthly contribution to their health plan. So on the plans and rates web pages and on our CalPERS website, there is a section that shows the employer contribution amounts for all of our state members. Okay. Have any addition? Am I missing any questions that?
We did receive a question about the search tool, and it said that they searched for their doctor name and location. And I think in the compare section, it showed not applicable under one of the descriptions, and they wanted clarification on what not applicable meant. And I believe that was in regard to combo plan coverage, because in some instances, medical groups it shows availability, and for Medicare coverage, it shows not applicable because Medicare search functionality does not apply to medical groups. So I hope that answers that question.
Thank you, Anthony. I'm just going to give it another minute to see if we have any additional questions. Okay. Can I still enroll my child to my healthcare if they're going to turn 26 next April? What will happen? Melissa?
Actually, I'll go ahead and let Dwayne answer this one.
Yes, you can still enroll your child. You'll just receive the notification when they're about to turn 26 at the effective date of when they would be canceled from coverage. And that would, if the child's birthday, 26th birthday is in April, they'll be their last day of coverage will be April 30th.
Thank you. So a question on qualifying events. In the event of giving birth outside of open enrollment period, does that qualify us to only make the change of adding the baby to our existing plan? Or can the mom and baby both choose an entirely new plan? Dwayne?
You would only have the option to add the baby or the dependents, the mom and baby, if the mom isn't added.
So adding a dependent, that's all you can do. It does not allow you to change plans
Does
outside of
not
open
allow you.
enrollment, right?
No,
Okay.
it doesn't.
Thank you. With the change to UHC Advantage Group instead of Edge, will I have same coverage of specialists, medication, in and out of network providers? I believe it's all the same. I don't know if there's anything to add to that. Lisa or Yesenia?
No, the provider groups are the same for the UH Advantage.
And members in Medicare can see any doctor that accepts Medicare, correct?
Correct.
Thank you. Okay. Checking for more questions. And so I am enrolled in PERS Platinum Medicare Supplemental. Am I covered outside of the United States when traveling? PERS Platinum is available everywhere nationwide. So the answer is yes. And just to be sure, if you are enrolled in UHC Medicare Advantage and you want to keep it, there's nothing to do. And if you're in Edge and you want to continue to stay with UHC for your Medicare coverage, we will automatically move you. So for PERS Gold and PERS Platinum, even though they are both Blue Shield, do they have different provider networks? And what are those two different networks called? Yesenia or Lisa, do you want to add any clarification to this question?
I can go first, and Yesenia, feel free to add on. They are two different networks, and they go by the name PERS Gold and PERS Platinum. So those are the name of the networks, and it's very similar to Anthem, how Anthem operated previously. The differences are that Platinum is a slightly larger or broader network, and PERS Gold is a more narrow network.
And the only thing that I would add is that I would recommend that you utilize our tools, the Search Health Plan tool, to identify the providers within each one to see if they have your doctors in network, as well as if you're a basic member, you can contact Included Health to help navigate that and see if your providers are in network. And if you're a Medicare member, then you can reach out to Blue Shield for assistance there.
Thank you. So question, if my child is away for college in an area that is not covered by my provider, does she have coverage options? And so from what I understand, Blue Shield, Access Plus and Trio, and Anthem HMOs, Traditional and Select, and Kaiser offer away from home care programs. And I just learned this yesterday. So yes, they can see a doctor for primary care, but emergency services and urgent care services are covered everywhere with any of the plans. So that helps. Sorry, the questions just moved a bit. And so do you have a wide range of doctors in PERS Platinum and Gold? I'm trying to call a specialist and seems they do not have PERS. The clinic is not familiar with PERS. So included health, they can help find specialists and PCPs, so primary care providers. For gold and platinum, and you can go to their website, you can contact them. They also have care coordinators that can help. So definitely don't hesitate to contact Included Health. Okay. I'm over 65 and my wife is younger. Can we have Medicare PPO for me and regular PPO for my wife? So I believe this is in reference to a combination plan. So when you have somebody in Medicare and a dependent in basic, those combination plans are available, but you have to be enrolled in the same plan. So if you're in PERS Platinum, you and your dependent, whether either of you are on Medicare or basic, you would be in the PERS Platinum plan. Well, coverage or acupuncture for acupuncture and chiropractic care continued once Blue Shield replaces Anthem Blue Cross. And yes, it will, because the benefits are not changing there. Is UHC Medicare Advantage a PERS Gold or PERS Platinum plan? Neither. UHC is its own plan. So just we get that question coming in a lot. So it's probably worth clarifying again. Health team, are you seeing any questions that I may have missed?
There is one around prescription mail order, if they need to receive it by mail, if they want the 90-day supply. So Lisa, if you can maybe chime in.
Absolutely. Yes, if you are getting your prescription drug benefit through Optum, then in order to get a 90-day supply, you do have to use the mail order. I believe it is also similar with Blue Shield, though that would be with the Blue Shield HMO.
Thank you. And there was another question. We have some members wanting us to repeat the tool they use to check if a new health plan includes their doctor. So the Search Health Plans tool in My CalPERS, you can search for health plans and then it'll prompt you to include a doctor or a medical group in your search if you'd like. Also on the CalPERS website, there is the health plan search by zip code tool, where you don't have to log into your My CalPERS account, but you can still search for health plans and include a doctor in your search. And then of course, if you're enrolled in one of the PERS Gold or Platinum plans and you're a basic member, you can contact Included Health. So if I'm changing from an HMO to one of the new PPOs, how do I see if my primary care will take PERS Gold, Platinum, or Blue Shield? So you would contact Included Health to confirm. I don't know, is there anything else to add to that?
Included Health would be your best resource to help confirm if your provider is in network or not in either PERS Platinum or PERS Gold, which are both the Blue Shield PPO plan.
Thank you. Okay.
Vanessa, there's a question, or there's a few questions around the differences between Medicare Advantage plans and supplemental plans and whether ones are better than the other. So Melissa, if you could maybe assist our members in navigating or knowing which resources to use to help them make the most informed decision.
Sure, absolutely. So we do have our Medicare enrollment guide, which is a publication that you can find on our website, or if you call our contact center, we can mail you a printed copy. But that will, give you a lot of information about the different types of plans we offer, both Medicare Advantage and supplement to traditional Medicare plans, which are our PPO plans. So I would certainly look at that to see the differences between the types of plans there. You can also look at the health benefit summary for comparison of the benefits between all of the Medicare plans. So I would look there, and then of course want to look at the rates too, the premiums, and see if there's plans that are more affordable for you. So there's a lot of things to consider. And as Vanessa mentioned, there's a new tool to selecting your health plan that's available in the summary as well this year. So I would use all of those resources to help find the plan that's right for you.
Thank you. So we have some questions about verify. They just want to verify that if you are on a Medicare PPO plan, you do not have to involve included health in your health care. And that is correct. If you are in a Medicare PPO, you go directly to Blue Shield. And then there was a question to expand on new services, specifically on the doula benefit that is added in 2025. Is it for a specific plan only? And I believe that applies to all the basic plans, but Lisa, please add a little bit more.
You're absolutely right. The doula benefit, which starts January 1st, 2025, is available to all basic members, so all the both PPOs and all of the HMOs. And it is to help provide support during the prenatal and the postpartum period, as well as during labor and delivery. And it also is there to support members who may be going through an abortion or may have had a miscarriage.
Thank you. And I think this question is from Melissa. What's the difference between this open enrollment with CalPERS and Medicare open enrollment?
Sure, good question. So Medicare's open enrollment period is determined and administered by the Centers for Medicare and Medicaid Services, or CMS, and is separate from our open enrollment, in which you would choose your supplemental plan if you have one through CalPERS. So it's just it's completely separate from ours.
Thank you. And then members turning 65 in the fall of 2025, how do I transition from my PERS Platinum PPO plan to a Medicare plan?
I could take that one too.
Yes,
so,
please. Sorry.
No, it's okay. So we will notify you starting 4 months before you turn 65 of the process to coordinate your benefits, your Medicare benefits, with your CalPERS health plan, if you choose to do that. So just keep an eye out on in your mailbox, and you'll receive notifications from us. We send several notifications on this process. So it's a pretty simple process, and a lot of it's automated. So just keep an eye out in your mailbox and give us a call if you have questions or need additional assistance.
Vanessa, I think there needs to be clarity on which plans contact included health. I think I'm seeing a couple of questions here where they're asked, if you're in a Medicare plan, do I contact included health?
Okay, great. Yeah. And that's a good way to close here, because
Yeah.
we're coming up at time. And so as a reminder, Medicare members enrolled in one of the PERS Gold or PERS Platinum supplemental Medicare supplement plans, you will contact Blue Shield directly. There's no need to contact Included Health. That is for the basic plans, the basic PPO plans only. I appreciate everyone's thoughtful questions. Thank you, health team, for all the great responses. And as I mentioned earlier, we'll notify all of you, our members, when the recording of this webinar and FAQs are posted. If you have any specific or urgent questions that we weren't able to address today, please feel free to send us a secure message through your CalPERS account, or you can call us at 1-888-CalPERS. And just a reminder, if you're happy with the plan that you're in, there's no action for you to take during open enrollment. So thank you for joining us, and I hope everyone has a great day.